Hey everybody, today I'm going to just explain to you the steps of removing a Foley catheter. So the equipment that you're going to need are some exam gloves, a 10 ml syringe, and a drape, waterproof drape. So I'm going to verify the order because you sure don't want to take the catheter out on the wrong patient. So you want to verify your physician's order. And you're going to walk into the patient's room, knock, knock, wash your hands, introduce yourself. Hi, Mrs. Smith. My name is Angie. I'm going to be your nurse today, and the doctor has ordered your catheter to come out. So, woo, yeah, this is usually a joyous occasion, and people are usually happy about that, and you'll be their favorite nurse for the day. So I'm going to explain to her how this is going to work. I'm just going to insert the balloon and deflate it, and just going to pull it out. Nothing like it was going in. It won't be any big deal or whatnot with that. So I'm going to identify my patient first. Tell me your name and date of birth, and I'm going to confirm that with their bracelet that they have on. And also I'm going to assess any allergies that they might have. So I'm going to raise my bed up to working height. And before I do anything, I'm going to put my gloves on. And I'm going to look at the urine in the bag and see how much is in there. So I'm going to assess the bag, and then I'm going to empty it. I'm going to bring a graduated cylinder in. I'm going to empty the urine from the bag, measure it, document that. And now that that's done, I'm going to explain to Mrs. Smith. I'm going to take the blankets down, and I'm going to unclip my clamp. I'm going to put the waterproof pad down. This doesn't have to be sterile this time. So you just kind of put the shiny side down. You're going to want to take the leg strap off. Very Velcro-y. And then you're going to want to get your syringe, your empty syringe, empty 10 ml syringe. If you ever have a question on if you don't know how much water is in the balloon, it always will say it on this little label at the tip of the port, and this says 10 ml. So I know that there's 10 mLs in there. So you just hook it on, and it automatically, by the reverse pressure, will pull some of it out. So you don't have to pull hard on it, just let it do its thing. And then once it stops, just pull a little bit more, disconnect it, and then you're going to want to get rid of it into a specimen cup or the trash or whatnot. Just to make sure, though, that I got it all, I just want to attach it one more time and pull again, just to make sure that I have it all out. And I do. So I'm going to disconnect that. And now I'm going to say, Mrs. Smith, I'm going to go ahead and remove the catheter. Just take a big deep breath in and hold it. And as they're holding it, you just kind of pull out gently. Okay, you can just relax and breathe. And then you're going to kind of wad the tip up in your waterproof pad. And then you're going to dispose of your equipment per your policy and procedure. If it goes in a biohazard, if it goes in regular trash. Then you're also going to finish with peri-care. You're going to get your washcloth and just clean up around there. And you're going to put the bed back down. And you're going to remove your gloves and wash your hands. And then you want to explain to the patient, if you think about it, the reason they had the Foley catheter in the first place is because they were unable to void. So we can't just take a Foley catheter out and then go on with our day, right? We need to educate the patient and explain the things that we're looking for from here on out. So Mrs. Smith, now that the catheter is out, that means you can get up and you can use the restroom. But before you do that, I want you to hit your call light and let one of us come in and make sure that we put a hat or some kind of measuring device in the toilet so that we know that you are emptying your bladder appropriately. Because you don't want your patient to just get up and go to the bathroom and dribble some urine, because that's not really full bladder emptying. You want it to at least be 100, 150 mLs. Because if they don't void within whatever the physician says, I mean, different physicians have different protocols, but it's usually if they don't void between 4 to 6 hours, then you have to start thinking about straight cathing them or putting the Foley back in. So, Mrs. Smith, it's incredibly important that you just let us know when you need to use the restroom so we can measure it and make sure that your bladder is working appropriately. And you also want to make sure that the family members know that as well. Also, it might burn a little bit when you first go. Maybe there'll be a little blood, just depends on the person and the situation. And then you also want to keep accurate I&O records of that so that everybody is on the same page with that. So, and that is Foley catheter removal.